Let me just say that it's very dangerous to have a clinical psychologist and a Southern Baptist preacher to come before you and only have 10 minutes. But I will govern myself accordingly. Let me first of all say that it's an honor to be here with you all this morning. Certainly it's a pleasure to work with Mr. Bauman and his team around some of the very significant issues and challenges that face our country. Looking forward to engaging around evidence-based practices and research to undergird the compassion that we have for the people that we serve. I have the pleasure of serving as the Executive Director of the Northeast Delta Human Services Authority. Northeast Delta Human Services Authority is a legislative created organization to provide mental health services, addiction services, developmental disability services, and prevention services for 12 parishes or counties in Northeast Louisiana, or the Delta. And there's a reason why the blues come out of the Delta. It is arguably one of the most challenged areas in our country. And if you were to Google some towns to identify some of the most segregated, racially divided, economically divided, at least 2 of our cities will come up. The other areas that would come up would be Appalachia, and maybe one near you. But suffice it to say that in Northeast Louisiana, we have some of the most resilient people in the world, and at the same time, we have some of the most broken people in the world. We have some of the best health care in the country, but for others, there's no health care. We have some of the best schools for some in Northeast Louisiana, and we have some of the most tragic schools for others. But notwithstanding, we still have people looking for opportunities, people who are wanting hope, people who are looking for, yes, good government. And so one of the things that we are tasked with providing is, I mentioned, mental health and addiction services. We recognize that in our clinics across our region, 90-some-odd% of the people who we saw also had diabetes. They may have had an STD. They may have been suffering from hypertension. They were unemployed or underemployed. They were not stable in their housing nor their nutrition. And one of the things that we did when we became an authority back in July 2013, we went out to where the people were. We just didn't stay in our corporate headquarters and try to dictate how services would be rendered. We went out and met the people. I stood before the people like I'm standing before you to say, what are your needs? What are your challenges? And how can we work together to solve them? Well, very quickly, the people said, and in particular, the coroners, the DAs, the sheriffs, the police chiefs, the hospital executives said, we've got to do something about the people who are coming into our emergency rooms with a mental health or addiction. Besides, we need more inpatient beds and facilities. If we were better coordinated, we'd have a better chance for the population. We could save resources. So as a consequence of that, we actually started doing something. What we told communities we actually did that brought us credibility. It allowed us to then use our catalytic pool to push people together to work on behalf of those who were most in need and most challenged. And also in Louisiana, about 3 years ago, there was a mandate of integrated care. SAMHSA had provided the state of Louisiana some dollars to look at how do you integrate primary and behavioral health care due to the cost savings. And we recognized very quickly it's one thing to have an idea, It's another thing to be able to do it. And that's the challenge that we have as a nation with evidence-based practices and ideas. They're great, but how do you implement them? How do you make them actually benefit the people who they were intended to benefit? And then how do you sustain it over time? How do you get the people to use what it is as evidence-based practice? How do you get them to believe that if they use it, then it would benefit them and to reduce stigma at the same time? And how do you undergird it with social policy and public policy and resources over time? These are all the things that we do at Northeast Delta Human Services Authority to try to find ways in which to meet human needs and the complexities of human needs, and working across governmental lines and working with indigenous and people who are impacted by our services to sort of blend those things to make a difference in their lives. And so when I heard the various panelists talk about all the wonderful things that they did, I wish we were in one state. Because if we were in one state, we would do a significant job for those who are struggling. Because I can tell you that I've met with all of our plan CEOs who manage Medicaid programs. And I told them unequivocally that if you're going to work and truly meet the needs of your patients in Northeast Louisiana, you've got to come and develop the networks. I've yet to see them. And when I see them again, I'm going to mention to them, you gave me your word that you would come, but I haven't seen you to the extent to which I need to see you. So essentially, we have to develop our own networks. So I'm working with hospital executives. I'm working with sheriffs. I'm working with coroners. I'm working with the people in the communities, because the systems that are required to help us are squeamish, are not brave enough to meet true needs. And so I'm looking for them. And I know that this is being recorded, and know that I'm looking for you. But we have some outstanding momentum in our region. The good thing is that when you're tasked and you're tired of being sick and tired, you want to work together. And so across race, class, political ideology, people are coming together around a vision for what our region can be. So I'll leave you with this. And the researchers, we need you to help us quantify this. The most powerful thing in the world is the question, why? Or an ideal that's yet to come. One of the challenges in Northeast Louisiana, we don't know who we are. And one of the reasons why we work in silos is because we haven't learned to not work in silos. But when there is a collective vision for what we can be, and it's clearly understood and articulated, and it uses each entity's God-given talents, strengths, and abilities and resources to work towards that common objective, it takes us off the pettiness and focuses us on what's in the best interest of the people. So what we have been doing is visioning for our region, helping them think about what integrative care would mean and how it would impact them. Help them understand what good housing would be like, what good food would be like, what good primary health care would be, what good educational systems would mean for our region. Because at the end of the day, it is what we do for the least of them that really matters. And if we really wanted to have that beloved society that all of us, I think, in our heart of hearts want, we've got to actually do what we are researching and writing about. Because if you have it in the book, if you have it in the university, if you have it in the legislatures, how does it truly meet the needs of the people who are so desperately seeking them? I thank you for listening, and I'm looking forward to responding to any questions that you may have. Did I make my time?